so I get a lot of questions about puberty. And so I just wanted to go over with you what is normal, what's expected for both males and females in terms of when it starts, how long it lasts for, because they are very different from boys and girls.
For sure. Yeah, so let me sort of give you my Puberty 101 presentation here in 2 minutes. Girls start before boys, girls end before boys in most cases. So the average age of the start of puberty in girls is between 9.5 and 10. And that's typically breast development. Boys, it's
So the
between
start,
about,
so sorry, just to clarify for parents. So the start of puberty for female, you'll see breasts start to form, or you'll see, what will parents notice?
breast buds. Or the girl might say, oh, it hurts here because there's something under. She just noticed it's stretching the skin. And I get a lot of like worries. It's, oh my God, this pain. It's like cancer. It's normal when a breast first forms. It's not been there before. And so this overlying skin has to stretch to accommodate it. And there are nerve endings in that skin. And so the girl might notice it, or she gets hit with a soccer ball in the chest and she's gotten hit 100 times before and now it suddenly hurts and she looks there and she says, oh, there's a bump there. And then it's the breast bud at 10 or 9.5. And sometimes it starts on one side and and it's not on the other side. And the parents really freak out because they think that's cancer too. But that's probably the norm. It's not going to be perfectly symmetrical and start on the same, day. And sometimes one develops faster than the other. I joke around. It doesn't mean you're going to be a camel. A different. It just takes time for things to even out, and in most cases it does. But the breast bud is the first thing. 85% of the time in girls. 15% of the time it's pubic hair. But what's really happening, and we have no way to detect this, is truly if you were taking an exam and they wanted to give you a trick question, the first sign, if you will, of female puberty is enlargement of the ovaries.
Oh.
But we don't have any ability to determine that without an ultrasound machine. So, because the ovaries is where the estrogen comes from, and they have to get a little more mature to produce that estrogen, which then goes to the breast. And ultimately, 2.25 years later, goes to the uterus in sufficient amounts, along with progesterone, that you get the first period, known as menarche. So that's typically at about 12.5 years, about 12 years, 2 months in African American girls, 12 years, 8 months in Caucasian girls, 12.5 if you don't pay attention to race.
And what is the range of normal? Because there is quite a difference.
Yeah, plus or minus 2.5 years. So a girl,
Wow.
if a girl's 14 years and 11 months, she's still within that window. And probably if it was 15 years, 1 month, and it happened, wouldn't mean there was anything wrong. I mean, these are just rough statistical gauges.
So doing the math here, just for parents listening, because this comes up so much where it's so, I don't know if stressful is the right word, but when you start to see changes in your young children, all of a sudden they're 8 or 9 and you see signs of puberty and you wonder, is this normal? They seem so young to me. But if you're saying, let's say a girl is 8.5 and it's 2.25 years till she gets her period, that puts her over 10 years old. That's in the range of normal, correct?
Correct. Although sometimes when you start super early, you don't necessarily get the period as early as that you might think using that math that you just did. You may. But yeah, parents, they get like very concerned. I call it the gray zone for a girl of let's say 7 to 8 years, because we use a cutoff of 8. If anything happens before 8 in a girl, any aspect of puberty, we call that early. Between 7 and 8 is when most of those happen, and they're probably not going to turn out to be anything. But if you see one pubic hair, if you see a girl who's got chest development of a 13-year-old, even though she might be in the age when it's okay, it's not just when it happens, it's how fast it happens.
Okay.
See, again, everything in endocrinology is the rate. It's the speed with which these events occur, that when everything is either faster, higher, taller, whatever, too fast, that's when you always have to be more concerned. This thing starts at a funky age and just slithering along and not much is happening, 6 months later, there's 2 pubic hairs, whereas there used to be 1, not probably going to be anything. But if it looks like a carpet, that's a different story.
Right. Now, what about genetics? Like, if a mother got her period for the first time at 12, will we expect a similar pattern with her daughters?
Usually, usually the all aspects of puberty, including the beginning of it with breast development and the end of it with first period. There's a strong genetic influence.
And then when
As
do girls stop growing?
Okay, so the typical girl stops growing or has achieved most of her growth, about 96.5% when she gets her first period, if she gets her first period at the right age, of, let's say 12 and a half. There will be roughly between ages 13 and 15, or 12 and a half and 15, maybe another inch and a half, 2 inches if you're lucky, more if your parents are taller, that will occur, but it's at a much slower rate. So girls, they will get their growth spurt of puberty almost, it will begin essentially the day that breast development is evident. And it will, let's just say for like 10 and a half to 13, that's when they get their growth spurt. At 13, their growth spurt's over, they've got their period a couple of times, and they're going to go into this sort of slowdown of their growth. So at the age of 13, a girl has gotten that spurt, and a boy hasn't started his spurt yet. Because boys have to be in puberty for a year and a half. They have to have enough growth of their testicles, which is where the testosterone that causes their growth spurt comes from. And so at 13, it's not uncommon to see girls tower over boys. For those of you who've been to a party where there's 13-year-olds, like a bar mitzvah, that sort of thing, the girl's here and the boy is, here, and they put the music on, the dancing's supposed to happen, and they're kind of staring, like, oh my God, this is the creepiest thing ever. And I can never figure out if they actually do dance, who's more uncomfortable, the short boy or the relatively tall girl. But this is
Dr. Geffner, you're taking me back to awkward bar mitzvah days.
Well, nothing's changed.
I think a lot of people listening can relate how that's a definite awkward time in childhood.
Terribly awkward.
Terribly awkward. So the girls, once they go through menarche and they have their first menses, they'll grow maybe a couple of inches. Can we compare that to boys? I know you mentioned that you started to talk about it. How?
Right. So the start of puberty in boys is about a year later than it is in girls. So about 10 and a half. And the first sign of puberty in a male is enlargement of the testicles. And that can be determined if somebody looks. The boy usually doesn't know this, or is not aware of this happening at the beginning. The parents are not aware. They're waiting, the boy and the family, they're waiting for hair, pubic hair. And that usually happens about 6 months into puberty, defined again as a little bit of enlargement of the testicles. And we have devices to measure the testicle size. Sort of people call them the beads. The medical term for that is called an orchidometer. You can actually get one online if it's something you really want.
It looks like a necklace. You can disguise it as a necklace.
Yeah, some people have called it rosary beads. I've heard that before. But you can actually, we hold it up side by side with the testicle and we match it up to the volume that it most closely looks like. They're shaped like eggs, basically. And so you can determine that and you can know when somebody's in puberty, basically. But you have to be in puberty for about 18 months as a boy before you'll get your growth spurt, starting around the age of 13. And then the bigger the growth spurt, regardless of a boy or girl, is governed by the taller the parent. You get more growth in a growth spurt if you have taller parents than if you don't.
And when you say a growth spurt, what's the typical inch range we're talking about?
Okay. Well, it usually doubles, so you're looking at up to 4 inches per year for 2 years, maybe 3.5.
Wow.
I mean, again, it's a range because it's genetically regulated. So taller parents, their kids will have bigger growth spurts, and they did too, whether they knew it or not. A generation back, the parents of your parents didn't bring their kids to the doctor for this sort of thing. There's been a huge sort of change in priorities, I guess, or let's say recognition of growth issues. And some of it's driven by sports and stuff like that. But it's interesting. And to this day, the majority of patients, and it's not right, who are come or are referred for short stature are boys. So this reflects, this is, by the way, there's the same number of short girls in our society as there are short boys if you use a statistical definition. It's not different, but the referral pattern and referral bias is different and it's not changed. I don't know why exactly, but we definitely see more boys referred.
I think the reality is, right, in society, there's much more focus on male height.
Yeah.
So I guess it is.
There shouldn't be, but there is.
Right. I agree. There shouldn't be, but there is. And when do boys stop growing? So is there a chance they go to college and they continue to grow, or when can parents expect that their children will stop growing?
So the male growth spurt, as I mentioned, starts at 13 and ends at 15. So it's 2 years, just like in girls, but it's 2 years later. Between 15 and 18, there will be another 2 to 2.5 inches of growth. But if you think about that, it's like 1 inch per year. When in the middle of your growth spurt, you're growing 4 inches per year. It's relatively imperceptible.
Okay. So it's still happening, but the greatest rate of growth is between typically 13 and 15.
Right.
One thought that just crossed my mind, and I don't know, this idea of growth hormone and growth hormone injections.
Oh my gosh, we didn't talk about that.
So a lot of parents, if they have shorter children and they ask me, are growth hormones warranted? Are there side effects? What can we expect from growth hormones? What should parents know about growth hormones? What should their expectation be?
Right. So growth hormone, and it's actually in the singular, has been around in its current form since December of 1985. And when I say its current form, I mean genetically engineered. It was the second genetically engineered medication after insulin, if you're interested in a little bit of history. So 1985 to come 2025 will be 40 years of history soon. So we're 3 years shy of it, 37 years. So we know a lot about growth hormone in terms of how it works, its safety, and a fair number of its original users now have their own children. So we know sort of into the second generation, if you will. And I think that's really important because a genetically engineered drug was like just a complete new thing and novelty. And I think people at the beginning, like they are with other new things, are sometimes afraid to give it to their children. But it's passed the test of time. So there's now 8 products on the market, and there's, if you count, there's about 11 indications, so some of which are not in children and some of which have nothing to do with growth. But the obvious indication is growth hormone deficiency. But in order to have growth hormone deficiency, you have to have slow growth, you have to have a significantly delayed bone age, and you have to have some other laboratory abnormalities to confirm that diagnosis. And it works the best in that because you're giving back what's not there. And you don't even have to give a lot, just a whiff, and the kids grow like crazy. And very recently, the newest product, growth hormone product, just came on the market in October or November of last year, which is different from all of the existing ones. All of the existing ones are daily subcutaneous under the skin injections for umpteen years. This one is a once a weeker. So in a year, instead of 365 injections, it's 52 injections. And so it's the first, and there's 2 others coming soon, so there will be competition. But in any event, the indication for which it's most commonly prescribed is called idiopathic short stature. And I think that's what you're alluding to. So that's short stature for no apparent reason, which really means in many cases because it's just genetic and runs in the family. And it's defined. The FDA criteria for that are that the heights have to be below effectively the first percentile consistently, so really short. And the predicted height, and this is based on where the child is on the growth chart and the degree of bone age delay. For a boy has to be 5'4" or less, and a girl has to be, less than 5'4", and for a girl has to be less than 4'11". So if you're just going to be a late bloomer, they don't want you because you can get there anyway. And in the old days, when those criteria, 17 years ago, I think, roughly, when it was first approved for this, You know, drug companies just sort of checked the box and said, do it. Now, if you can get it, it's maybe 25 to 50% of the time. It's the best you can do because I think it's resource driven to some extent. And there's also not huge amount of data that shows that it actually works. That's the biggest one.
Yes.
You know, in fact, I think you can't really even use the limited data that are out there. You have to do each child individually, which means then you have to have a trial, which means you then have to take it all the way to the end, or you don't know. So this is very complicated. But I would say that you know, in many pediatric endocrinology practices, this is the number one reason for which growth hormone is prescribed. I'm not going to get into right or wrong. You know, ethicists will tell you, if you got all that money and you want to buy it, why don't you should just spend it on therapy for yourself and your child, and not on growth hormone.
Right.
I'm being a little bit sarcastic here, but if you read articles in the New York Times magazine section a few years ago, this is exactly what it says. So
How much height are we talking about? Let's say they take the subcutaneous once a week injection. What's the actual difference?
That one I don't know because the studies didn't go to final height. They were only for like
Okay.
you know, a year height velocity, which was comparable, in fact, even slightly better than daily growth hormones. I don't know. With daily growth hormone, you know, it's very variable, but it's in the range of, you know, 3 inches maybe. But for some people, you know,
Okay.
5'4" to 5'7" in a boy, maybe that's important. You know,
Right.
I
It's not
can't.
It's not a half an inch.
Yeah, if it was half an inch, we wouldn't be talking about this. You just don't know in a given child unless you do it. But the good news is about a growth hormone trial is if you're going to get a response, you get it right away. You know right away. So in the first 6 months, that height will go, you know, and if it doesn't, you know, like double the rate, then it's not going to 6 months later. See,
And
that's
just to make it clear for parents listening, once your child's gone through puberty, it's too late.
oh yeah. I get some people come in and say, my child's in puberty. I was told to come in now. No, you want to come in before puberty. Okay. Here's the reason. In normal circumstances, the more growth you get before puberty, the taller you're going to be. Even though you get a growth spurt with puberty, puberty still marks the beginning of the end. So you want to be the
Yes.
tallest you can possibly be before puberty.
Right.
'Cause-
So what would the ideal time be to come see you? Maybe what age range would you
Hey,
say?
well, it depends on when the growth issue first comes up, but you know, I would say certainly, you know, between 5 and 10. I mean, under 5
Yes.
for this is tough on the kid because of the needles and all, but so I'd say 5 to 10. And you don't, you know, also part of the equation is how is the child functioning in the world? And it's hard to know if a 3-year-old or a 4-year-old's functioning compared to other kids in terms of, you know, social things. It's harder.
Now, out of curiosity, I'm not sure what you're going to say about this, but do you have a lot of referrals for transgender children that are looking to change how they, you know, before puberty, how they grow and the hormones involved? Do you play a role in that at all in your clinics?
At Children's Hospital, we don't. The
Okay.
transgender program is housed in adolescent medicine. But that's not true, for example, at UCSF or in Boston Children's. So it depends on the institution. And you're going into a whole
Interesting.
other complicated area
No, I know.
about hormonal
I can cut that. I was just more
manipulation and
curious.
surgery that is super controversial these days in
That's
younger
what I was
children.
wondering. I mean, more just out of curiosity, if you were getting any of that pressure on your end to make those kinds of decisions.
Um, we will be shortly. Let me put it to you that way. There have been conversations, but the surgical programs related, for example, to I mean, we're getting off base a little to children who have
Yeah.
born with genitalia that you can't tell if they're male or female. That whole thing. The programs for surgery in children who can't consent have been shut down at Harvard and at Northwestern. Just so you're aware,
Wow.
due to pressure from advocacy groups.
Dr. Geffner, I so appreciate you coming on here.
It's my
I
pleasure.
value so much of what you have to say, and I know that so many people listening will really appreciate all of this information. So thank you so much.
My pleasure anytime.